We have a quorum, and it is the appointed time. I call to order the meeting. Item 1, information paper issued since last meeting. No information paper has been issued by the Secretariat since the last meeting. Item 2, items for discussion at the next meeting. The next meeting is scheduled at 8:30 a.m. to 10:30 on Monday, the 26th of October this year. The administration will issue the items for discussion at the next meeting at a later point of time. You'll be notified of the items once the Secretariat has received the proposed items. If there is no objection, the meeting is tentatively scheduled in the morning of the 26th of October. Item 3, Corporate Governance, Resources Utilization and Manpower Policy of the Hong Kong Tourism Board. We now invite the government officials as well as the Tourism Board officials to come in. Please press the Request to Speak button if you wish to speak. The government officials and the representatives from the Tourism Board in attendance of this item are Ms. Joanne Chu, Deputy Commissioner for Tourism from the CSTB, Mr. Anthony Lau, Executive Director of the Hong Kong Tourism Board, Ms. Lucy Choi, General Manager, Strategic Planning and Digital Transformation of the Tourism Board, and Ms. Alice Lee, General Manager of Corporate Affairs from the Tourism Board. Welcome. I will now invite the government official to give us a briefing. Good morning, Chairman and members. Today we are briefing members on the Corporate Governance, Resources Utilization and Manpower Policy of the Tourism Board. It is a statutory body established in 2001 under the Hong Kong Tourism Board Ordinance. Its core function is to promote Hong Kong globally as a leading international city in Asia and a world-class tourist destination. Under the framework of the Culture, Sports and Tourism Bureau, or CSTB, the Tourism Board plays an essential role in marketing and promoting Hong Kong worldwide. Through organizing and supporting mega events with cultural, sports and tourism characteristics, we tell good stories of Hong Kong, actively enhancing visitors' experience and allows them to experience the distinctive culture of Hong Kong. The Hong Kong Tourism Board is committed to upholding a high standard of corporate governance. All board members are appointed by the Chief Executive according to the Tourism Board Ordinance. There are 5 board committees. Through internal audits, declaration of interest and integrity and property system, we ensure that the work of the Tourism Board and the utilization of resources are up to the highest corporate governance standard. I will now invite Mr. Anthony Lau, the Executive Director of the Tourism Board, to brief members on the manpower policy and resource utilization strategies of the Hong Kong Tourism Board. Thank you, Deputy Commissioner. Chairman, members, good morning. As mentioned by the Deputy Commissioner just now, the Hong Kong Tourism Board is committed to upholding a high standard of corporate governance. Through a comprehensive monitoring system, we manage our resource prudently and ensure that our policy and our strategies are working in commensuration of our financial resources. Now, under the policy of financial prudency, we deliver our work according to the budgets approved by the government. Besides using government subvention wisely, we also proactively strive to secure sponsorship and also to enhancing other income sources so as to take forward our publicity and promotional work with the greatest efficiency. organizing activities to support the trade's development. We also have a stringent financial control and procurement policy in place. There is stringent control and monitoring of our subventions. In terms of manpower policy, we recruit staff members through under the policy of transparency and merit-based selection and fairness. We also have a comprehensive training and promotion system. In terms of law compliance, we comply with the laws of the jurisdictions which we are operating in. We also set the remuneration and benefits package in accordance with the prevailing economic situation as well as the other market salary trends to ensure that the level of remuneration is reasonable. Now, through good corporate governance and other efforts, we actively tap visitor source markets to enhance Hong Kong tourism industry's competitiveness and also bring about the high-quality developments of the tourism industry together with the sector. That concludes my report. We welcome questions and views from members. 5 members have pressed the button to speak. Each member will have 4 minutes, questions and answers included. The members are Mr. Kingsley Wong, Wu Yingpang, Lam Wai Kong, Augustine Wong, and myself. Mr. Kingsley Wong, please. Thank you, Chair. I would like to learn about the KPIs and manpower policy indices of the Tourism Board. Now, in organizing activities, there's a series of indices, including the visitation of the websites, participants of events, and also exit surveys. Now, according to the Audit Commission's report, in terms of mega events, the Audit Commission says there should be specific indices, including the number of visitors that the mega events bring to Hong Kong and also the economic benefits brought about by the mega event. So will the Tourism Board enhance its indices according to the Audit Commission's recommendations? That is, including the number of visitors generated as well as the economic benefits of a certain event. Now, in terms of manpower, according to the Audit Commission, the Tourism Board has not conducted a review on the salary structure. Now, there are 5 posts which has deviated from the acceptable level of market trend, that is 85 to 110%. And there are 33 posts, that is 40% of the posts which have deviated from a reasonable range of market salary trend. Now, two salary review has been conducted. So have you corrected the deviation after these reviews? And also, the Tourism Board has not regularly submitted a salary report or the reports of the top management salary to the CSDB or the CEDB. Such a review has not been conducted in 20 years' time. So since the audit report in 2020 has review been conducted? I will take the question on KPIs and I will defer the other questions to the Executive Director. Thank you, Mr. Kingsley Wong, for your question. We attach much importance to the performance of the Hong Kong Tourism Board. Annually, when the work plan is formulated, we will set 6 targets concerning the development of the tourism industry. The first and foremost is the number of visitation. Second is the amount of money spent by visitors. 3, the number of overnight visitors. And 5, the willingness of visitors to recommend Hong Kong as a tourist destination. So every year, we would give an account of these indices. Now in 2026, the Tourism Board estimated there would be 53.8 million visitors coming to Hong Kong, and the per capita spending of overnight visitors is $5,530. Now in terms of average length of stay, sorry to interrupt. My question is whether these two indices are set for the mega events held by the Tourism Board. Yes, they do. For each specific mega event, there would be specific indices set. For example, the number of participants and the ratio of visitors against local participants, and also the satisfaction rate. The Tourism Board would conduct on-site survey to gauge the satisfaction rate of the participants. So the Tourism Commission under the CSTB is the contact point with the Tourism Board. We would hold meetings every 2 months. And also there are daily contacts with the Tourism Board on a daily basis. So we would discuss these indexes. For example, the per capita spending of visitors, and also which attractions these visitors go. And then there would be a report after each mega event to report on the outcomes of these activities. For example, the wine and dine festivals. In terms of manpower policy, I would defer the question to the Executive Director. First of all, an apology to Mr. Kingsley Wong. I didn't have the opportunity to read the Audit Commission's report in 2020, but according to my colleagues, after the report has been published, we have follow-up on each of the recommendations. I've just recently rejoined the Tourism Board. As far as I understand, there is an annual review on the salary structure of the Tourism Board. We compare the salary structure of the civil service as well as the market salary trend to conduct a review on the reasonable level of remuneration for each post. If necessary, we would adjust this salary level according to the change in market salary trend. Now, concerning the review of salary for the top level management, this review is part of the annual review. So the range is 85 to 120%. That's the range. Salary increments is packed with performance. Now, for colleagues, with lower salary but good performance, we would give them a larger extent of pay rise. Now, for those colleagues whose salary exceeds the range of 120%, they would not receive a pay rise. At most, there would be a pay rise in accordance with the inflation, since the salary has already exceeded the range. Now, there is a rare case for there may be colleagues with a pay equivalent to 80% of the market trend. that is more common for new recruits. So we would adjust the pay on an annual basis. I think Mr. Lau can be more succinct. My apologies. If the performance is exceptionally well, then that would be reflected in the annual pay adjustments. Now, what about the reports of the CEDB? Would you provide the figures?
Madam Chair, in 2020, the Audit Commission compiled a report on the Tourism Board. The report has been submitted, and we can provide the relevant information to Mr. Kingsley Wong. Thank you. Next, Mr. Wu Yingpeng. Thank you. Thank you for providing us with the information. In paragraph 19 of the papers, in 2023, the Tourism Board set up the Data Privacy Office, and in paragraph 25 of the papers, the Tourism Board is planning to work with Discover Hong Kong to launch an AI-enabled itinerary planning function. I believe this is a good function. That is because we can provide personal itineraries for tourists. On cross-boundary data flow, I have some questions. Take the mainland as an example. When you work with third-party platforms in the Chinese mainland, when handling mainland visitors' personal data, how can you make sure that you will comply with all the requirements, meeting requirements of the Chinese mainland and those of Hong Kong, such as the PDPO, as well as the relevant legislation of the Chinese mainland? We need to prevent data leakage as well as malicious cyber attacks. Thank you. As we mentioned, the Tourism Board has set up the Data Privacy Office. Take visitor information as an example. We collect as little information as we can in order to limit the scope. The Tourism Board has a very well-rounded mechanism to prevent data leakage. Please be succinct. Thank you. Mr. Lau? Thank you. The Tourism Board already has laid down a governance framework in relation to the protection of personal privacy. We have already set down the internal requirements in order to make sure that we can meet the relevant legislation, that is the PDPO. When it comes to collecting personal data, the Tourism Board, while promoting the relevant events, needs to collect personal data and information. In this regard, all the information collected, as well as information directly related to the businesses, as the Deputy Commissioner said, will be bound by the principle of keeping the information collected to a minimum. In addition, we also make sure that we comply with the retention period of personal data. We delete information as soon as possible whenever it is not needed. We also have a well-rounded mechanism to prevent data leakage. We assess the nature of any possible leakage, and we also inform organizations as soon as possible, as well as the persons affected. We also initiate investigations as required. We will also roll out remedial measures if need be. The Tourism Board has been keeping up with internet changes as well as technological advancements in enhancing the relevant security measures. Thank you. Any follow-up? No follow-up. Thank you. Mr. Lam Wai Kong. Thank you, Madam Chair. I thank the officials for reporting the tourism board to us. I'd like to ask about resource allocation by the tourism board. The information papers mention different funding schemes. That said, it's come to our attention that manpower is key to the provision of quality services. So I'd like to know whether the tourism board will provide training courses to help the industry to enhance the service quality in order to provide better services to tourists. Next, when it comes to using big data, the information paper is silent in this regard. Will the tourism board take the initiative to work with other departments? Will they collect data in relation to places frequented by visitors? After the point-to-point transport services are available, will the relevant data be collected in order to drive the development of tourism? We can make good use of big data. I'd also like to ask about the Hong Kong Pals Tourism Volunteer Program. When it comes to in-depth tourism, this is indeed a good program. Do you have any concrete schemes that can enhance the use of resources? How can we make better use of the Hong Kong Pals program? Next, I'd like to turn to human resources. There are a total of 15 global offices comprising 120 staff members the world over. I'd like to ask about the utilization of resources as well as KPIs. Do you have regular reviews of global offices? What is the effectiveness of the promotion of tourism? Thank you. Mr. Anthony Lau. Thank you, Mr. Lam, for the questions. We have an effective mechanism. We want to give good experience to visitors coming to Hong Kong. We have a brand. That is the Quality Tourism Services Scheme. There are a total of 8,000 various companies joining this scheme. Most of them are retail and F&B industries. For those taking part in the Quality Tourism Services Scheme, they are under our supervision. We make sure they are delivering services as they pledge. The quality of services needs to be of high quality. This is how we will continue to award the Quality Tourism Services label to them. We work very closely with the retail and F&B industries in Hong Kong in the hope of providing high-quality services to visitors. Regarding the use of big data, we do use big data, in fact. The Immigration Department provides information to us. In addition, we also collect different big data from different tourist attractions across Hong Kong. We're working with AMAP, and we also make good use of the resources as we have from Google Maps to embed the information into AMAP. This will be launched by the end of this year. This will provide more information to tourists. Whenever there is any other information that is of good use, we will also incorporate it into our new function. Thank you. Any follow-up? What about the Hong Kong Pals program as well as the global offices? I'd like to know the KPIs. Thank you. Mr. Lau, I will answer the second question. There are a total of 15 offices the world over. We see if we need more or fewer of these global offices. We tread very cautiously when it comes to determining the number of global offices needed. We don't rush to set up a new global office immediately. As per our conventions, we first gauge the market demands. In the past 10 years, we haven't opened a new global office. However, we are now considering opening new offices in emerging markets such as the Middle East. When it comes to manpower resources, we have visitors services center. We have close to 200 volunteers helping us to recommend different tourist attractions across Hong Kong to tourists. Thank you. Next, Augustine Wong. I have 4 questions. The first question relates to manpower management. Do you have any statistics in relation to staff attrition rate? In paragraph 38, I can see that you have very rigorous internal audit mechanisms. Do you have any record in relation to staff disciplinary actions? In paragraph 13, you mentioned internal audits. Were there any serious cases that warrant reporting to the management? In paragraph 22, I'd like to ask about sponsors provided by other organizations. Do you have any figures in relation to the ratio between the sponsorship and the revenue? I'd also like to ask about paragraph 28. Thank you. Mr. Lau, regarding staff attrition rate, about 10% every year. It's below 10%, in fact. Comparing with other market promotion organizations, the turnover rate is comparable. The most significant changes are seen in the entry level. Those younger employees want to have other development opportunities. Some other employees leave the tourism board and then they will rejoin us. We welcome them. When it comes to sponsorships, box office income, the sale of items, and so on. Sponsorships take up a lion's share of our income, accounting for about 60% of our income in general. What about disciplinary actions and cases? Yes, there are indeed disciplinary actions such as warnings or advising them to resign. They make repeated mistakes or they underperform. We have an internal disciplinary mechanism to handle these cases. Do you have any figures? Well, actually just 1 to 2 cases every year. So you don't have information at hand? Indeed, we will provide after meeting. What about cases? Can you tell us more about the cases? Most of the cases are dealt with according to internal mechanisms that have to do with internal procedures. Before employees leave, they pull pranks. There are indeed such cases, but are they very severe? That is, did they have to do with money? Fortunately, we have had good internal management and governance. From time to time, the ICAC comes to the tourism board. They provide advice to us in relation to the governance framework, and we have a rigorous governance framework. Do you mean no? They have been asking you about figures. Can you cut to the chase and give us any figures? Well, I can provide you with cases in relation to disciplinary cases after the meeting. Thank you.
好似未答。
My fourth question has not been answered. Are there any events under government sponsorship failing to meet a standard and subvention is withheld? Yes, there are such activities. We will provide you with the data after the meeting. Ms. Julia Lau. Thank you. Now, $1.6 billion of subvention. Among it, how much is spent on recurrent spending items, for example, remuneration, and how much is spent on organizing mega events? For mega events, what is the selection criteria in terms of the type of activity or exhibitions? Now we had the red hot balloons, and the public was astonished at how much money was spent on such an event. Now the event was awarded to a famous luxurious brand. So for mega events, I think it's quite difficult to ask for competing tenders. So how would you select the organization to which the event is awarded to? Deputy Commissioner, I will take the first question. Now the total subvention amount is $1.66 billion for year 2026 to 7. Every year, the Hong Kong Tourism Board organizes and advertises a number of events. So $1.32 billion have gone to marketing for its flagship events. Now the remaining $300 million is for the recurrent expenditure item, including rental and remuneration of staff. Now concerning selection criteria and also the service contractors to award the contract to, I would defer to Mr. Anthony Lau. Thank you, Chair. First, we would consider why we are organizing a certain event and how we are organizing it. Over the past 2 decades, the Tourism Board has built up our brands on 6 major events. That includes the New Year Countdown, the Float Carnival, Dragon Boat, Cyclothon, and Winterfest. Now this year we are adding 2 more. That is Halloween celebration and Mid-Autumn celebration. Now each event is characteristic of Hong Kong. And also, they can generate a lot of visits to Hong Kong. And thirdly, these events would garner international limelight. For example, the New Year Countdown. We position Hong Kong as an international city. That's why we have a New Year Countdown, which attracts reports from international media. That would increase our presence in the international media. Second, there are festivities unique to Hong Kong, which can attract visitors to Hong Kong. Now, the Mid-Autumn Festival is a widely celebrated festival. And also, that time period coincides with the golden travel period in the Northern Asian region. We are also organizing a Halloween activity this year because this is our famous activity. And it is popular among youths worldwide. The Halloween celebration will last a month is not a scary event, but rather a cosplay event. What about my question on tender selection? Now, for each mega event, there would be a large number of tenders. For example, under wine and dine, there would be 8 to 10 tenders. For example, lighting on stage. We would find a professional to do it. And also we have internal requirements for the number of tenders and price. So all vendors would detect all tenders from vendors would be compared with other competitive tender. Is that the case? Yes, there would be several tenders for comparison, and then we would seal the bid, and then we would analyze and evaluate the tenders. Mr. Nick Chen, Chair, in the 2026-7 budget, the Financial Secretary has earmarked $200 million to establish the pilot scheme on Rural and Urban Integration Fund for the Northern Metropolis, which includes developing the tourism sector in the Northern Metropolis. Now, the Tourism Board would flexibly deploy its subventions for developing the tourism sector. So will the Tourism Board deploy more resources to develop the MICE tourism as well as rural tourism in the Northern Metropolis to fully tap the potential there? Executive Director or Deputy Commissioner. Thank you. Now, the $200 million is for developing the tourism sector in the Northern Metropolis. Now, for high value-added visitors, for example, MICE tourists, we have other schemes to attract them. Now, we have leisurely tourists, and we also have commercial and business tourists. Now, for MICE, on average, the per capita spending of visitor is $7,500, higher than the average of $5,500 of other tourists. So every year, we have a lot of mega events attracting MICE tourists to Hong Kong. Now, the annual meeting of the Lions Club has attracted 17,000 visitors, including the family members to Hong Kong. They will stay quite a while in Hong Kong. Now, the Northern Metropolis has the blue and green tourism circle. So we have been supporting the tourism sector to develop itinerary in relation to ecotourism. For example, boat trip to the geopark, so as to seize the opportunity. Now, there is also the Ecotourism Committee, which is responsible for developing itineraries for the blue and green circle in the Northern Metropolis. Now it is my turn to ask questions. Now, concerning the law compliance audits each year, the Prevention Against Bribery Ordinance is an important factor here. The provisions will be incorporated in the contracts. So what is the latest progress of that? And concerning the representative offices in the world, there would be different legal and cultural challenges. So how can we ensure that the operations of these offices are in full compliance of Hong Kong's law? And also, how does the law compliance system for global offices work? Thank you, Chair. Every year, the Tourism Board requires our overseas officers to conduct an audit in accordance with the prevailing laws in the jurisdiction. After the report is submitted to the committee, we would evaluate the report. Now, the last compliance report was conducted in July past. So far, no problems have been found. Now, there are seven components under the compliance audit. For example, licensing issues and whether renewal of licenses is called for. Second, on employment, whether there are breaches in relation to employment, and also insurance, whether insurance packages are in place. And then personal data privacy, and also prevention of bribery. And finally, equal opportunities. Concerning applying Hong Kong's law in our overseas offices, now of course our head office would be in compliance with Hong Kong's law, but our overseas office would have to comply with the local laws. Every year, our internal audit departments would conduct internal audits at different time points. They would evaluate whether our overseas offices have been working according to their plans. Now, we conduct an internal audit for our head office in Hong Kong, which are housed in the single building every 5 years. So we are reviewing whether we should make the audits more frequent. Our internal audit department would consider whether we need to conduct more regular review on the operation of our head office. So that in terms of our work of ensuring that our operation is in compliance with the law. Now, concerning audits for overseas office, you said the audit is conducted every 2 years. So would you send an in-house team from Hong Kong to conduct the audits or engage a local auditor? Both. The internal audit team is quite small, so we would first engage an overseas audit firm to do the basics, and then our team would go to the place and check the report. So our internal audit team flies quite frequently. I press the button again because I have another question. Concerning cruise line, as well as halal certification for restaurants and other subvention schemes, as well as those for MICE tourists, there are evaluation mechanisms for applicants which falls below the standard. The subvention amount will be decreased. And concerning the free schemes I've mentioned, can you give us the total amount of subvention issued? I'm more concerned about the halal certification pilot scheme. Now we are receiving more visits from Middle Eastern media. They are very interested in the scheme. So can you give us a progress? Now for those applicants which underperform, how much will their subvention be reduced? And how do you conduct your assessment?
Thank you. Whenever we roll out new schemes, our colleagues design the specifics of the relevant schemes. We lay down different rules. We also try our best to work with the ICAC. We ask the ICAC for professional views. From the application process to other phases, the ICAC provides recommendations to us. So for all application items, they have been scrutinized and reviewed by our colleagues as well as the ICAC. They also go through different functional committees and the board. For the development of cruise tourism and MICE events, all the procedures go through the procedures within the tourism board. They go through different functional committees. For those with a larger price tag, they will have to be approved by the board. Last year, about 2,500 organizations have received subventions, and the cash subventions amounted to $130 million. We spent more on cruise tourism and MICE. They have larger MICE events, thus requiring more financial commitments. There have been good results. When it comes to MICE events, that is funding support for bidding for large-scale MICE events, we have relevant provisions written down very clearly in the contract. In other words, for different projects, you have a professional team to scrutinize these projects. However, you have a uniform mechanism to decide on the amount of money that needs to be paid back to the board. Is that correct? Well, we liaise with the host organizations. We have T&Cs, that is terms and conditions in relation to the amount of money that needs to be paid back to the board. Say if the amount goes beyond $5 million, they will have to go through the relevant functional committee. Thank you. Thank you. 2 members have pressed the button to speak again. Mr. Augustine Wong, thank you. I'd like to follow up on Ms. Julia Lau's question. When the tourism board needs to seek services provided by outsiders, they need tenders. Say for the stage, audio, and lighting, these are professional aspects and professional services. It's not that easy to identify organizations that meet all the relevant requirements. In fact, we are bound by the overall industry ecology. Such providers are thin on the ground. So, are there many exemptions in this regard? Exceptions in this regard? Well, actually, in Hong Kong, we have no lack of suppliers. Before we accept a supplier, we do have a mechanism. The suppliers will have to go through a mechanism whereby they will have to declare their financial conditions as well as the relevant information. Then they will be put on our list. Only then can they take part in the tendering exercise. Based on my observation, usually there are 2 to 3 organizations submitting bids, not just one single bid. When we invite tenders, there are probably 4 to 5 organizations in total. for single bids, when they do not submit the bid, probably there is just one left. Every year, there might be 3,000 to 4,000 bids. The percentage is not on the high side. Dr. Johnny Ng. Thank you, Chairman. The Tourism Board has a total of 15 offices globally in 6 different markets. There are other offices as well. They're responsible for driving the development of tourism in Hong Kong. I'd like to ask about this. What about the criteria for setting up overseas offices? Do you have any plans to set up new offices in emerging markets? The chief executive went to the Middle East. I mean the Middle Asian regions, such as Uzbekistan and Kazakhstan. Do you have any strategies in relation to this? Thank you. Mr. Lau, every year when we work on our budget, we take into account internal staff size. We also consider the number of offices and whether we need more or fewer offices. These are our important considerations. The cost of opening one more global office comes at a high cost. That is why we tread very cautiously. Usually when we set up a new office in an emerging market, we are very cautious. Take Singapore as an example. We have a base in Singapore. However, in other markets, there are other offices that represent the Tourism Board of Hong Kong to set up an office in these emerging markets. Regarding whether there will be a new office, we are working on our plan. We are planning to open an office in the Middle East. Now, the development of the Middle East is mature, and we are proactively considering whether time is ripe for us to open a new office in the Middle East. And owing to the war that is going on right now, I believe we need to wait until the later time before we will see a new office in the Middle East. Thank you. Mr. Lam Wai Kong. Thank you, Chairman. I'd like to follow up on the question asked by Ms. Julia Lau. That is about the provision of $1.66 billion. $1.32 billion will be spent on mega events. I'd like to know if there will be any independent audit targeting each and every mega event. I'd also like to know whether there will be a publicly available report detailing the use of resources. Thank you. I'd like to talk about the overall provision of $1.66 billion, of which $1.32 billion are the budget of the Tourism Board when it comes to market promotions. Promotion of markets. Well, there is actually a new program that is only in Hong Kong. MICE events, MICE tourism, cruise tourism, and funding schemes to promote the conduct of events. They are covered under the $1.32 billion of provision. Just now, Mr. Lau also made reference to other events such as Halloween, Mid-Autumn Festival, and so on. The Tourism Board does not host these events. However, the Tourism Board provides significant support in relation to market promotion. This expenditure is covered under the $1.32 billion. Regarding promotion of smaller districts, the expenditure is covered under the amount of $1.32 billion as well. Any follow-up? No? All right, next, Ms. Julia Lau. Thank you. I'd like to follow up on a question asked just now regarding the 7.5 million heart scheme. How can you invite tenders? I'd like to turn to Team Lab. Team Lab organizes eye-catching events all over the world. Say the event in Japan is very appealing. People need to buy tickets as early as months ago before the event. And people even need to fly to Japan. However, for some events, such as outdoor events, it's quite different. I'd like to know why. Why are they different? Thank you, Mr. Lau. Member referred to two events, and they are actually held by third parties. The tourism board does not take part in these events, in the holding or in the conduct of such events. Well, you need to monitor. You need to supervise the conduct of these events. Don't just say that they are held by third parties. Well, let me be direct. The tourism board does not fund these events. Regarding the projects Ms. Julia Lau just now mentioned, we were not involved in the setup of these events. That said, we helped with the promotion of these events on our website. We monitor. Well, do we monitor these events? No. These are beyond our control. So you mean the money isn't provided by you, is that correct? Well, let me add more information regarding the Hearts events. It is under the Cultural Mega Events Fund. The Cultural Mega Events Fund, or Mega Aids, they aren't part of the Tourism Board initiative regarding the activity of the Team Lab. It is an outdoor installation display coordinated by the LCSD. They aren't held under the purview of the Tourism Board. The Tourism Board is simply responsible for promoting Hong Kong. So on the website of Discover Hong Kong, the Tourism Board promotes these events to visitors overall. In other words, they make suggestions as to what you can see and visit when you come to Hong Kong. Any follow-up, Ms. Lau? Well, it's difficult for me to come up with any follow-up questions. Well, when you can think of any follow-up actions, you can follow up with the administration after the meeting, Ms. Lau. Thank you. All right, thank you. We have wrapped up this agenda item. Let's move on to the next one. Overview of medical and dental benefits for civil service eligible persons, CSEPs. Members can refer to documents provided by the administration and the background brief prepared by the Legislative Secretariat. We have received a representation provided by the civil service. That is the submission from the Coalition of Civil Servants on Medical and Dental Benefits. Let's invite the officials to join us.
Members who would like to speak, please press the button now. The government officials in attendance of this item are Mrs. Ingrid Yang, Secretary for the Civil Service, Mr. Alex Chan, Deputy Secretary for the Civil Service 2, Dr. Cheng Wai Lun, Project Director, Chinese Medicine Hospital Project Office, Dr. Edmund Fong, Deputy Director of Health, Dr. Kitty Xie, Consultant of Dental Services of the DH, and Dr. Larry Lee, Chief Manager, Cluster Performance of the Hospital Authority. Welcome all. Five members have requested to speak. They are Mr. Lam Wai Kwong, Chris Ip, Ms. Julia Lau, Mr. Professor Chen Shou Kwong, and myself. Each member, or rather we will invite Mrs. Ingrid Yang to walk us through the paper. Thank you. The government, as the employer, has an obligation to provide medical and dental benefits for civil service and civil service eligible persons, or CSEP. Today, together with the Department of Health and the Hospital Authority, we are reporting to members the latest overview of the provision of medical and dental benefits for CSEPs. Now, we mainly provide medical and dental benefits to CSEPs through family clinics and hospitals. It covers hospital care, allied health services, general and specialist dental services, and Chinese medicine services. And concerning prescriptions prescribed by doctors from the HA or the Department of Health which are not available in these departments, CSCPs may apply for reimbursement of medical expenses for these drugs. We also seek to enhance the medical and dental services for CSCPs. In terms of family clinics, the Cheung Kwan O Family Clinic will begin providing integrated care program and SDU starting from the third quarter of this year to cater to the needs of patients with chronic diseases through more comprehensive allied health services. And depending on the progress of the work, the new family clinic at the Kwun Tong Composites Development Project will be commissioned in the fourth quarter of the 2027. Now, we have launched the pilot scheme for provision of civil servant influenza vaccination for 2 years now. It is very popular. And also, we have increased the number of family clinics providing civil servant this during evening session from 3 to 4, so as to provide more services to civil servants working in shifts. In terms of dental services, the dental manpower shortage of the Department of Health has eased, and some dental clinics have been reopened. The DH has gradually arranged more CSEPs to return to our dental clinics in a timely manner to receive scaling services and checkups. Also, we have extended the pilot scheme on dental services in Shenzhen to 2027, and we have increased the quota places from 2,000 to 3,000. We are also extending the pilot scheme on dental services to the end of this year with some 60,000 service quotas. For Chinese medicine services, besides the 3 clinics, starting from the 20th of July, we will provide designated services in the Chinese Medicine Hospital of Hong Kong, with 5,000 service quotas in each of the first 2 years, totaling 10,000 for 2 years. The scope of designated services will be positioned as primary health care, covering general outpatient consultation, general outpatient intervention, and outpatient integrated allied health services, with a view to providing more diversified CM services. Looking forward, we will continue to monitor the implementation of the above enhancement measures on medical and dental services for CSEPs. We will maintain close collaboration with the Health Bureau and the Department of Health, as well as the Hospital Authority, to enhance the services where possible. Thank you, Secretary. There are 5 members waiting to speak. Each member will have 4 minutes, questions and answers included. Mr. Lam Wai Kwong. Thank you. I thank the Civil Service Bureau for enhancing the benefits for civil servants. However, I would like to reflect some views from the unions. Now, there will be a new family clinic providing evening services for civil servants, but the number of service quotas is insufficient. So will the government consider providing more evening session services for civil servants? Now, on dental services, the Department of Health has been recruiting more dentists to reopen some dental clinics. Now, the remaining dental clinics will be reopened in the next few years. Exactly when? When will the civil servants' demand for scaling services be met? Now, concerning the pilot scheme on dental services in Shenzhen, it has been extended, and that's good. However, according to some civil service, even after scaling services, other services would be required, for example, tooth filling. So would the government consider extending the scope of the scheme to other dental services other than scaling? Secretary. Thank you, Chair. Concerning evening consultation, at present in Tuen Mun, Wan Chai, and Yamade, there are family clinics providing evening consultation services to CSEPs. Now, there are still quota desks available for civil servants. The utilization rate is just 80%. And we are going to add a family clinic on the list. We will monitor the utilization rate continuously. If the rate is high and there are demands in other districts, we will discuss that with the hospital authority. We need to monitor the situation after the fourth family clinic is opened for evening service for civil servants. For dentist recruitment, we don't have an estimation yet when the gap can be completely filled. We will continue with the recruitment effort. So we don't have a timetable of reopening the remaining clinics yet, but the situation has significantly improved. We have now taken back some outsourced services. Now, concerning follow-up dental services after scaling, which are more complicated in nature, these are provided by the Department of Health's dental clinics. Now, with better manpower situation, the waiting time for these services has been shortened. More nurses have been hired to follow up on cases. So with improvements in the manpower situation, the waiting time will be even shorter. Can we outsource the service? Now, the main purpose of the dental clinic under the Department of Health is to provide scaling service. Now, we outsourced the service to some private clinics in the first place because the waiting time was long and because of shortage of dentists, some clinics were closed. Scaling is a rather simple and standardized procedure. For other procedures requiring clinical judgment, we believe it is better for the Department of Health to provide it themselves. Next, Mr. Chris Ip. Thank you, Chairman. I declare interest. My wife is a civil servant, so I am also a CSEP, but I'm not a participant of those schemes. I recognize the government's effort in shortening the waiting time for scaling service from 29 months to 15 months at present. Now, concerning the waiting time for old consultation cases, will the government set a KPI to shorten the waiting time to 12 months or shorter? Second, on the pilot scheme on dental services in Shenzhen, the second tranche has more quota places from 2,000 to 3,000. So how did you set the quota at 3,000? Is it very popular among civil servants? Last question on Chinese medicine services. What is the annual estimated expenditure on the enhanced service? Secretary. As we have said, the waiting time for scaling service has been shortened from 29 months to 15 months. That's the average waiting time for a scaling booking. Now, you don't need to scale to receive scaling service too often. So I would defer the question to the experts. Dr. Kitty Hui from the DH. Now, concerning the number of quota places for the pilot scheme of dental service in Shenzhen, that's 3,000. For in-service civil servants, a factor is the long traveling distance. Now, civil servants may apply for a half-day leave or a shorter period of leave to receive dental services locally. Since Shenzhen is quite far away, the leave arrangements does not apply to the Shenzhen scheme, so civil servants have to take a half day off to join the pilot scheme in Shenzhen. So we are not quite sure whether this program would be well received by in-service civil servants. So we set the initial amount of quota at 2,000. Now, some civil servants have withdrawn from the program, so we have made the free-up quota available to other civil servants, but we will manage to fill up all the quota places. So one must consider that civil servants have to spend their own leave on the pilot scheme, and for older civil servants, they may not want to travel to Shenzhen. So we think that 3,000 is an optimal number. And also we have locally outsourced scaling services. It seems that our colleagues are more prefer to receive scaling services locally. Now, concerning expenditure on the enhanced Chinese medicine service, that's under a block vote funding, so it's rather difficult to analyze the breakup. But so far, the fund is still sufficient. Dr. Kitty Hui, thank you. Concerning the waiting time for regular checkup, we have reduced the waiting time by much. Now, the average waiting time for civil servants is 17 months. Concerning follow-up treatment, it's more difficult to set a waiting time target. The complexity of each treatment is different. For tooth filling or root canal treatment, the waiting time would be different. It depends on the kind of treatment one is receiving. So the median waiting time or average waiting time of follow-up treatment is hard to gauge. However, with the improvements in manpower situation and the reopening of consultation rooms and clinics, the waiting time for regular checkups and follow-up services has been shortened. So where manpower is available, and also with more dentist interns returning to provide service after training, the waiting time would be shortened.
Just now, Mr. Lam Wai Kong asked about waiting time. Is there any KPI? At present, 29 months to 25 months, there has been a significant improvement. Do we have any KPI? With more manpower, we can check our figures again. When we have further updates and information to provide, we will update members, and we are confident that we will further shorten the wait, not just 15 months. Thank you. Any follow-up? No. Mr. Chris Ip, any follow-up? No. Next member, Ms. Julia Lau. Thank you, Chairman. Oral health matters. Otherwise, it may lead to a lot of different disorders, or it may impact on your work efficiency as well. If there's a long wait for dental services, it's not ideal. Before we have sufficient dental officers, can we work with dentists in the private sector? Can they provide temporary services at a reasonable cost? That will help us solve the problem. Thank you. Secretary, well, for dental scaling services, we have already achieved this goal. Well, what about non-dental scaling services? Secretary, well, as I said, dental scaling is a standard service. It's a simpler dental procedure. Quality control is easier. After all, the DH needs to ensure the quality is up to scratch. As for more complicated follow-up treatments that may involve clinical decisions, clinical judgment, and different procedures may have to be conducted in order to help the patient. These procedures might be best performed by DH dental officers. After we have subcontracted some services, despite the fact that they are services under a pilot scheme, DH colleagues can focus on more complicated procedures. We have managed to engage more dental officers, and while the pilot scheme is still underway, as Dr. Kitty Hui just now said, it takes a shorter time for us to follow up on patient's case. There's been an improvement, and there won't be any significant delay in the treatment of colleagues. Well, what about non-dental scaling services, such as tooth extraction, tooth filling? There are no waiting time issues, is that correct? Well, there is indeed a wait, but then the waiting time is being reduced. Can you give me any details? Well, cases vary from one to another, so it's actually very difficult to come up with a median number given the different nature of cases. Dr. Kitty Hui, thank you. We want to give our colleagues a follow-up consultation date for the colleague to come back. And we need to factor in the severity of the cases. If a case is urgent, then the colleague will be able to come back after a few weeks or 3 to 4 months tops. Each dental clinic has urgent treatment services. If they have severe tooth pain, they do not have to call up the clinic. They can directly come to the dental clinic. Dental officers on duty can take care of the patient immediately. They can provide appropriate, immediate services to the colleague, and then depending on the severity of the case, an appropriate follow-up consultation will be arranged. Well, I guess Ms. Julia Lau means that the pilot schemes on dental services, dental scaling is a PPP project. The effectiveness is good. She'd like to know if the administration can explore providing other services such as tooth filling under PPP. Is it possible to expand PPP? Can we provide more services to the CSEPs so that the waiting time can be reduced further? I hope that the CSB can look into the matter further. Ms. Lau, any follow-up? Yes, this is exactly what I mean. Thank you, Chairman. Next, Mr. Chen Cho-Kwong. Thank you, Chairman. I'd like to declare that I am a retired civil servant. I am enjoying the dental benefits as a retired civil servant. I applaud the CSB. It's done quite a lot. They have been exhausting all means to make enhancements, such as outsourcing dental services, making available services in Shenzhen. We have a total of 507,000 civil servants. In 2026, about 280,000 civil servants. Well, 1 in 2 out of 280,000 civil servants can receive dental services. One in 2 civil servants can receive dental services. The base figure is 500,000. That means 280,000 civil servants could receive such services. We have double identities, so to speak. We are retired civil servants, but we are also members of the public. People are saying that we enjoy double benefits. Criticisms have been leveled against us. Well, that being said, we are employees. We should be entitled to medical services provided by employers. When I joined the government, I could have dental scaling every 8 months. However, the situation has been worsening. It's about 2 years and a half at present. These double identities make it difficult for us to enjoy services. There is no winning party at all. It's an all-lose situation. Since the hospital authority has taken over the situation, I can testify that the situation has been worsening. The hospital authority needs to accord priority to medical services for members of the public. Can we think out of the box to tackle the problem faced by civil servants when it comes to dental services? There is a lack of suppliers. The hospital authority finds it difficult to provide sufficient services for the public. So how can they still provide services to civil servants? The government cannot be a good employer in the sense that it cannot provide sufficient medical services to its employees. When a civil servant goes to the hospital authority to seek medical attention, they have double identities. Will there be any overlapping of financial resources? Is it possible to take out medical insurance in order to make enhancements? Is there any new method for those joining the administration beyond the year 2000 when they leave the civil service? Let's not talk about retired. They have nothing at all. So they might as well take out their own medical insurance when they join the government. Newer civil servants find it difficult to secure a spot when it comes to dental benefits. They cannot even secure a spot as if there were no such services. Well, let me set the record straight. The quota of 2,800,000 is the quota for family clinics. As for family clinics, civil servants discs under the hospital authority, there is an additional quota of 550,000. We haven't yet factored in Chinese medicine clinic. For civil servants joining the government beyond the year 2000, if my memory serves me correctly, starting from 2024, at the start of each month, civil servants need to make a call to register. At present, they can register online as an in-service civil servant. If they want to enjoy medical dental benefits, yes, for sure they can. They can register online. As for outsourced pilot schemes on dental services, as I understand, we asked new civil servants whether they are open to joining these pilot schemes. There are quite many civil servants who have already joined the scheme. As members said, we are making the best of our existing resources to provide as much as we can. Will we use new methods such as medical insurance? Well, if I remember correctly, there was a subcommittee under the panel on public service. We already responded at that time. There are different age brackets within the 550,000 civil servants. Some CSEPs are very young. However, some are retirees. They are probably in their 90s. If we need to take out medical insurance for such a group of people, the medical insurance expenditure will be astronomical. Against the backdrop of the current financial position of the government, this is unbearable. This is beyond what we can do. Outpatient clinic discs, we do provide such services. I have already given the figures just now. We have been making enhancements. And just assume, even if we can take out medical insurance, civil servants as members of the public can still enjoy public services provided by the hospital authority. It's not easy at all to deduct the quota enjoyed by civil servants from the overall figures, not least critical illnesses. So the decrease in resources on the part of the hospital authority might be difficult to be calculated. So the resources from the public coffers of the government would definitely increase significantly. Therefore, under these circumstances, we will not consider taking out medical insurance for all civil servants or all CSEPs. That being said, we adopt flexible approaches. We better utilizes our resources as well as social resources in order to provide high-quality dental services to civil servants and CSEPs. In addition, for the civil servants joining the administration beyond the year 2000 and our on Provident Fund scheme, it's not just about the quantity of dental benefits, it's about the terms and conditions as well as the conditions of services for civil servants. In about 1999, we conducted a study. We tried to match the conditions of service for civil servants to those of employees in the private sector. We make sure there is no significant deviation. So beyond retirement, in the private sector, there are no dental benefits, and this is exactly one of the focuses in the reform at that time. Any follow-up? No follow-up. I do understand that the government is having a difficult time when it comes to fiscal position. However, as a retiree from the civil service, we do need to make enhancements in relation to this situation.
I'm the last one to speak. Now, today's topic is on medical and dental benefits for CSEPs. Now, this has been a regular discussion item for this panel. So, taking this opportunity, I would like to clarify how the medical benefits for civil servants work. Some wonder why civil servants are given the civil servants discs with priority service in family clinics. I hope the government would explain this to the public better. Now, the 180,000 civil servants receive medical benefits from the HA. It is like a private company procuring a medical insurance policy for their employees. Now, under the block vote funding, the expenditure is included. Although many members asked the government to separate the accounts and compile the breakdown for the expenditure of the HA concerning medical expenditure on civil servants, but the government says that's not possible. So I hope the public will understand this is just how the government is taking up its obligation as an employer to provide medical benefits to the employees. Now, members have asked questions on both medical and dental benefits of CSEPs. My question is in relation to the designated services provided by the Chinese Medicine Hospital for CSEPs. I'm pleased to learn that starting from the 20th of July this year, the designated services will start. The CSEPs have been waiting for a very long time. We were hoping that these services would be made available to CSEPs right from the start, from December last year. But that was not the case because preparation was still incomplete. So we thank the government for finally providing designated services to CSEPs starting from the 20th of July at the Chinese Medicine Hospital. So after that date, the CSEPs will have to make a booking at the Chinese Medicine Hospital through the app. What if the cases are referrals from other Chinese medicine clinics or other Chinese medicine practitioners? Do the patients still have to use the Chinese Medicine Hospital's app to make a booking? In other words, whether you have referrals, you would be put in the same queue with others. Now, the Secretary said that for the first 2 years, there would be 5,000 service quotas. The expenditure is about $4 million. So it would be covered by the general funding scheme, and no separate funding is required. So the expenditure is $33 million for designated services for CSEPs. However, the utilization rate of Chinese medicine consultation quoted disc is already above 90%. So where did you come up with the $4 million to provide the designated services for CSEPs at the Chinese Medicine Hospital? Now, the CMCDRs in the 18 districts in 2020, there were 2 for civil servants and In 2023, there were 3 with a quoted number of 30,000. So we hope that we can gradually increase the number of Chinese medicine clinics for civil servants. So does the Secretary have a plan on extending the service to all 18 districts? Thank you, Chairman. First of all, whether we can break down the funding for the HA into services for the general public and the services for the civil servants is not possible because we have been providing the funding to the HA under a block vote funding. And over the years, the HA has been providing medical services to the civil servants. So it is impossible to break down the account. And also, civil servants are also members of the public. As members of the public, they can also receive highly subsidized services in public hospitals. So where should I accrue the sum to the public accounts or the civil servants' accounts? That's impossible. We can't determine which capacity the patient is. Now about booking at the Chinese Medicine Hospital. All members of the public, including civil servants, have to make a booking through the same channel. That's the app. Now for referrals from Chinese medicine clinics or CM practitioners in the private sector, I would defer that question to Dr. Zhang Weilun. On the other questions, where does the resources for Chinese medicine services come from? Now, these services are provided through a lot of agencies, including the Department of Health, clinics, family clinics, and also the Chinese Medicine Hospital. Now, the overall budget is still sufficient in covering the Chinese medicine expense at the Chinese Medicine Hospital. And whether we will designate a 4th Chinese medicine clinic for civil servants. Now, those are tripartite clinics. The HA, the government, and the university for teaching purposes. So part of the clinic is for training purpose of the research institutes. So the government only subvents parts of the operation of the CMCDRs. So in order to provide some CM services to civil servants in these CMCDRs, we have set a dedicated quota number for civil servants. We need to consider the capacity of those CMCDRs in providing services to civil servants. But I believe that in the next few years, there will be some expansions to these CMCDRs, and there may be room for increasing the number of quota places for civil servants. I will defer to Dr. Zhang Weilun on referrals from Chinese medicine clinics. Thank you. First of all, on the mechanism of referrals. Now, there is a general clinic in the CM hospital. Referrals are not needed. Members of the public, including civil servants, can simply make a booking on the app. For specialist clinics, there is some internal medicine acupuncture and traumatology and so on, and orthopedics. Referrals are needed for that. Now, the mobile app is very convenient. Both kinds of cases can be booked through the app. For those with referrals, you simply need to attach the referral for the hospital's consideration. It's a very intuitive approach. If a booking is made, then that's confirmed. Now, without the app, patients may have to wait for a disc in person in vain. So the app will be very clear. You will be able to simply select a time slot suitable to you and have a consultation. Now, since the commissioning, when the Chinese Medicine Hospital was commissioned in December last year, Chinese services were not made available to civil service. That has been agreed by the government as well. There was possibility to provide Chinese medicine services to civil servants, but the positioning of the CM hospital is very unique. It's neither a public or private hospital, and it is also the first Chinese medicine hospital. So we need to wait until all the operations have become smooth before we make available civil service CM slots. Now, no more members have questions. That concludes this item's discussion. I thank the government as well as the HA for their attendance. The last item, AOB, there being no AOB, the meeting is adjourned. Thank you.